Welcome to the Inspired Hygiene Podcast. I'm your host, Rachel Wall. I'm an RDH and founder of Inspired Hygiene. For over 20 years, we've had the unique opportunity to see what really happens inside thousands of dental hygiene ops and what it takes to create transformational change that impacts the lives of patients, practice owners, and teams. Each season, we'll focus on one powerful topic, breaking it down with practical strategies, real stories, and tools you can use right away. Let's get into it. Hello, everyone. Welcome back to the Inspired Hygiene Podcast. I am super excited to welcome our guest, Dr. Kyle Bogan. Welcome.
Welcome. Thank you. I'm glad to be here. Thanks, Rachel.
Yeah, very happy for you to be here. So we met because you have been a client of Inspired Hygiene for some time now. And Catherine Gilliam is your coach, and you guys have had a fabulous experience. She's had a fabulous experience working with you because you're a fantastic leader in your practice and your team has really stepped up. And you all were already doing very well. And you just kind of raised the bar with the hygiene department and really took it to the next level. So thank you for the opportunity to work with you and your team. And I learned from Catherine that you are not only just kind of how you lead your practice, but you're also stepping into or have stepped into a leadership role with your state, with the Ohio Dental State Association. So I'd love for you to just share a little bit first about like your career journey and kind of what led you to this place in your practice, but also in this leadership role.
Yeah, absolutely. Thanks. And again, great to be here. So I started my career in dentistry as an associate dentist, like many people do. I had the opportunity to work in several different practice settings, from private practice to health department dentistry, and different types of private practice. And at the end of the day, I would say I was probably 3 or 4 years into my career. I realized I wanted to really focus on the patient experience and the level of care that patients received, and making sure that that was constant across the board, no matter whether we took insurance, we didn't take insurance. We kind of took insurance out of the equation, and really just treated the patient as, our patient, and really what's best for their overall oral health care and their overall healthcare period. So that led me to do a startup dental practice. And so I found kind of those are the principles that I founded my practice on. And again, it's been a pleasure working with Inspired Hygiene to help level up our care. And it really, truly has done that. And so while I think we were providing great care before, the level of care we're providing now is at another level. And that's been amazing. And stepping into leadership at the Ohio Dental Association has been great, and kind of taking, that to the next level. I've always been passionate about teamwork and working together, at the practice. And now at the Ohio Dental Association, really taking that in a statewide effort to make sure that we're providing the best level of care to the patients of the state and access to that care, as well as supporting our dentists and making sure they have what they need. So it's been an honor for me to step into that role. And I think it gives me a unique perspective on kind of dentistry as a whole.
Oh, yeah, you get to see kind of a whole different angle, right, of dentistry and
Yeah.
a whole different segment of that. I've not in my career been very involved in the legislative side, and I'm always super appreciative of people that are willing to do that because it's needed and it's it's a big commitment. So, I would say from your perspective, like, what are you I mean, I think we've talked a lot in this season of the podcast about the term shortage of dental hygiene or dental hygiene shortage. Some folks believe there's not a dental hygiene shortage, and others, typically the ones who are hiring dental hygienists, are like, oh, yes, there is. And I think some of it is semantics on, maybe in Ohio, maybe you have these statistics, maybe in Ohio, the number of licensed hygienists maybe hasn't changed that much, but the way in which hygienists are working, particularly in private practice, has changed dramatically. What do you think about all that?
Yeah, I think you kind of hit the nail on the head maybe with that. So, I do believe there's a workforce shortage in many industries, but really I think across the board in dentistry, across all departments, I think one could argue there's a bit of a shortage, but especially in hygiene. And I think, in my mind, there's maybe 4 different reasons, like maybe that people are feeling that pinch, especially in hygiene. I think during COVID, I think there was a percentage of hygienists that just left the workforce. So I think that's a piece of it. I think that, coming out of COVID, maybe work-life balance conversations changed, and maybe there's a percentage of hygienists that no longer want to work full time, and so that kind of contributes to that feeling of shortage. I think a lot of times hygienists like to at least start their career in a temporary fashion with staffing agencies, and so I think maybe that's played into it. And I think the training programs have a hard time keeping up um, with the need, so to speak. We're graduating more dentists these days too. There's
Mhm.
new dental schools opening across the country, and so I think all of that has kind of come together to create this perfect storm. Um, and there's different barriers to those class sizes in those educational programs as well.
Mhm. Yeah, I would say that is consistent with what we've seen too. Okay, so what is happening in your state? Just I'd love to kind of take a look at that because we're, in the news always hearing like different things are happening with legislation and what's happening in your state to address kind of the workforce shortage as a whole in dentistry.
Yeah, so we've been working hard over the past several years, both legislative and outside of the legislative arena, trying to help our members and all dentists kind of provide the best care they can to their patients with a full staff and a fully educated staff too. So so we're blessed in Ohio that we have been able to expand the dental assistant certification pathways. And so in Ohio, traditionally we've had Danby, and then Ohio we've had our own called the Dental Assistant Certification program. It's kind of Ohio specific to get the CDA for assistants. And so we've been able to add American Medical Technologists to that. So we've had a third pathway to kind of, that lets
Okay.
dental assistants expand into being an EFTA or being, getting corona polishing or other things that we allow in Ohio. Um, at the state level last year, we passed the Dentist and Dental Hygienist Compact. We're one of 12 states now. And so with that, it allows dentists and dental hygienists greater mobility of licensure. So when they want, it kind of breaks down those barriers to moving states if that's something that they need to do.
Mhm.
And then workforce development, we've done a lot. And um, we collaborated with other state dental associations to reach out to CODA, the
Mhm.
Commission on Dental Accreditation, for some standards reform.
Mhm.
Trying to get those programs to be able to meet the workforce needs by maybe expanding within those regulations.
So, are you speaking of allowing, like, more dental hygiene students per instructor? Is that one of the
That's one thing I think but more importantly, is class size. What a lot of people don't realize about CODA is once you expand, and I think that number is 10%. I could be wrong. Don't quote me on that. But if you increase your class size by more than 10%, you have to go through an entire reaccreditation process, which is a huge process. So if you've got 20 dental hygiene students right now, if you increase more than two, even if you have the faculty ratio, and then that's fine, and you have the facility. It triggers that reinspection and reaccreditation with CODA. So there's lots of things on the CODA side that I think could help these CODA accredited programs really up the number of enrollees if they're able to.
I was not aware of that. So that is a very if in fact it is 10%, maybe it's 20%, right? But
Yeah.
that is a very thin margin, right? Of because most dental hygiene school programs are probably between 20 and 40, I would say. So yeah, that's not adding very many students. So how how much progress were you able to make in that regard? What do you see in the future for that?
Yeah. So I'm hopeful. I don't know that we've seen much progress. CODA is an independent agency, although the American Dental Association has a relationship with CODA. It's by its nature kind of an independent organization, so they have their own board and they work through that. So again, not a whole lot on that end that we've seen, but we've tried.
Mhm.
We've all, at the same time in Ohio, we've worked with program directors to try to give them strategies and any assistance they need in expanding their programs within the current confines of CODA. They need help
Mhm.
attracting faculty. They need funding for different things. We're kind of try to give that assistance to get them what they need to meet the need.
That's great. The next episode in this season that's wrapping up the season, I'm going to talk about what dentists can do even just on a grassroots level to support their dental hygiene schools, from just going in and, doing a guest lecture to, allowing hygiene students to come in, on a periodic basis and just see what it's like in a real world dental practice. I mean, most of them are probably shadowed, but it's a very different experience once you've been through a certain amount of the program, then you see yourself there, and you really can see what it's like. I think that's really great. What
Yeah,
about,
what we've done.
yeah, go
Oh,
ahead.
sorry. No, I was just say, well, one of the things to your point, what we've done in Ohio too is a kind of an infomercial, so to speak, radio campaign to get people excited about careers in dentistry, and the opportunities that they have to advance, through the careers. And so, and one of those things is, hey, call your member dentist, reach out, come in and shadow. Like, it's all about seeing it in action for folks that kind of think, hey, this might be fun to do.
That is exactly how I became a dental hygienist,
Oh yeah.
is I was interested in the healthcare field, and I had a dental hygiene appointment, and then 35 years later, here we are.
That's right. There you go.
37 years later. Yeah, yeah,
Yeah.
here we are. But that's exactly right. I love that idea. I have not heard that before. Maybe other states are doing that and I'm not aware of it. I know that the ADHA had some goals to, kind of increase awareness of dental hygiene as well as a career path. And so I think that that's really great, is just to create that awareness. And so one thing I found in some of my research was Columbus State Community College, they've invested, I think it was like $120 million, maybe the state invested in that school
Mhm.
to build this oral health hall, Ohio Health Hall, which was all focused on high demand healthcare fields, including dental
Mhm.
hygiene. So that's really encouraging. I like that. What do you think? Do you see any changes in your state that you can speak of? I understand some of these things you may not be able to share, but any changes in your state with regards to either dental assistants being able to do supergingival scaling, or dental hygienists, expanded duties or changes in what's required to become licensed, or are you seeing any of those things coming down?
We're not seeing any of those things, and it's
Okay.
funny when I gave my remarks to our House of Delegates, and we discuss workforce a lot, obviously. Um, when I gave my remarks to the House of Delegates, knowing what's going on around the country with OPAs and various things, I made it very clear, and the reason I talk about CODA a lot is I feel like it's incumbent on our profession to really stand behind the use of fully trained CODA accredited program dental hygienists.
Mhm.
I think the level of education in these CODA accredited programs not only makes sure that people are competent in what they do and maintains the safety and the quality of the care we provide to patients, but it's also upholding the integrity and the trust that people place in our profession. And
Mhm.
not that I'm for or against, or I understand states are going to do what they want, but I feel like in the state of Ohio, we're standing behind the fact that we really like the dental team as it is. We just need to provide creative solutions to make sure that we're getting people trained in the workforce, because our doctors in Ohio are definitely, our dentists in Ohio are definitely feeling the crunch of not being able to provide the quantity of care they provided in the past. So it's becoming an access to care issue. But I don't
Oh,
think we
yeah.
need to change I don't think we need to change our standards to meet that challenge. I think we need to think outside the box, possibly on how we can expand access to these CODA accredited programs. I think scope of
Okay.
practice should stay the same. Yeah.
Okay, okay. So, are there have you seen new programs come into existence in Ohio in the last few
We
years?
have, and I'm trying to think of a couple of them. We had one, I believe, one hygiene program that was in danger of not existing anymore, and so we were able to help keep that in place. And then there was one, there was somewhere in Ohio, and the name of it's leaving me, but we did start a hygiene program, or help them start a hygiene program, and we're constantly in contact with various programs and career colleges throughout the state, and educating them really on EFTA programs and hygiene programs and the ways in which they can expand the programming that they already have and use existing facilities. And some of these programs are like, I didn't even think about that. So just us being engaged, we've had a really good amount of success in expanding programs. Now, some of it's expanding a hygiene program from 20 students to 28 students. So again, within these CODA confines, we're not creating, 200 hygienists extra a year, but I think it's baby steps that'll get us there.
Yeah. Yeah. I, I learned, that my dental hygiene school where I went here in North Carolina, did not have an incoming fall class. So we have a whole
Mm.
missing class because there were some I'll just say significant challenges with the past director, and they didn't have a director. They do now, they have someone amazing now, but they didn't have the director, they had to go all the way through CODA certification, and, like, all that was not able to be, completed in time for an entering fall class, so that's 30 students that are not going to be coming into our state. Now, the good news is I learned about 3 new programs in North Carolina. Now some of them have 10 hygienists, but, it might grow from there as the
Yeah.
demand grows as well. So, I think that's great. I think just looking at all those things and just putting our heads together, and our message really is, okay, well, if you're in a state that does have the OPAs, how can we really pair them with a hygienist so that we're really making sure that that quality of care is still there, um, and I would think probably most of the OPAs would like to work in conjunction with, dental professionals so that they feel confident in what they can do. Um, so I think that's great, and I think that, I would love to see North Carolina implement, like, an FDA program. We don't have that yet, and I don't know if that's on track or not, but I think that's fantastic. So how does how has this we'll kind of pivot and talk about like how the current state of workforce has impacted your practice, and then this whole season of this podcast is all about like building the hygiene and dentist relationship. And I know
Okay.
you very much empower your hygienist, and just based on what you shared just now about like really working to preserve, quality of care and I would say integrity of the license and what happens, what's done by a dental hygienist. Just how has all of that impacted your practice and, in the last few years?
I think part of it is really making sure that we're maximizing everyone's abilities, and so it makes dentistry fun when you can practice your full scope. And so that's one thing at our practice we try to do, is make sure that everyone can practice within the full scope of their license and certification. It helps with patient care. It helps them feel fulfilled in their positions. And I have even, this started for me well before COVID. When I started my practice, I've always been a team-centered person. I wrote a book on it a while ago. That was before COVID, but really, I think patient care starts from the bottom up. And so, the old adage of like the leader being at the top and everything trickles downhill. I think we're all side by side working together, and I think
Mhm.
um, that's what made our practice so great to work with you at Inspired Hygiene. I feel like you guys have that same philosophy, and so really, I think we try to do our best about empowering our hygienists to be diagnostic partners, and it elevates the entire practice. So they're not just doing tasks; they're critical thinkers who really drive those patient outcomes. And I think
Mhm.
that's been a huge for our practice.
Mhm. I say that a lot, is that is honestly kind of the primary thing that we coach. We coach on specific systems and processes and products and diagnostics and all that, but the overarching theme is mindset and critical thinking. Helping hygienists and really the whole team see themselves as true healthcare practitioners, and then like, okay, what does that mean? That means I'm ready to step up into that. So can you give a specific example of like maybe a um, a clinical um, service or a clinical process maybe that the hygienists or your dental assistants have added that's moved them closer to that working at the top of their license versus what they were doing before.
Um, Yes, and I don't know that I mean, maybe it doesn't fall into the licensing, but it's something that we've added that I think opened eyes and really leveled up the care, and that's salivary diagnostics.
Wow. Okay.
And
Yeah.
so both assistants and hygienists are doing that. It's within their scope. Um, Mostly our hygiene team is doing that. Um, but it was eye-opening to them. We talk about being that critical thinkers, and that getting that data has been game changing for us on the restorative side, because you look at an implant that's has a bleeding pocket, and you think, oh, well, there's no attachment there because it's an implant. They probably didn't brush well, or they haven't been flossing. And then you take a salivary diagnostic sample, and you learn that there's bacteria in there that can cause periimplantitis and implant failure. And so it causes you to look at the case differently. And then you're talking about adjunctive therapy and all that stuff. And so,
Mhm.
there's been a few things like that we've added over the course of the last year or two that I think have leveled up our um, critical thinking skills that have allowed
Mhm.
us to better treat the patient in that
Mhm.
regard.
That's great. Thanks for sharing that example, and I think that also kinda flows into that. So often we have the mindset of like, well, if this isn't working, the patient's doing something wrong, or I've done something wrong as a clinician. I mean, I heard that this week, a hygienist who said that she's getting more comfortable presenting therapy to patients she's been seeing for a long time. She's like, "I just thought they weren't getting better because there was something wrong with what I was doing. I wasn't doing a good job or I wasn't, disrupting the biofilm or whatever." And yes, sometimes we do need to evaluate our clinical skills, but in this particular case, it was really just looking at like, look, this is an immune response, and there could very likely be something that's happening. Either yes, the patient's not disrupting the biofilm, or they've got some other overall health impact that is, affecting their ability to heal. And the first step is recommending treatment for that active inflammation. You know,
Yeah.
because if we just keep doing the same thing over and over and expecting the different result, like where that's going to get us, everybody's frustrated. Or
Yeah.
we just accept the fact that this patient's just chronically bleeding and inflamed. And what we know is there's so much more happening below the surface.
Well, and there's in Ohio specifically, thinking of, maximizing your license. One thing that's coming, it's not here yet. It started with our House of Delegates taking a position that, we would love to see it happen at the Ohio Dental Association. And there's the legislation and the rule is pending. But it looks like we're going to get it is dental laser use by dental hygienists, which would be a huge addition to the armamentarium of our hygiene team to be able to
Mhm.
combat this disease. Yeah.
Mhm. So, what goes into something like that? I'm assuming, like, there needs to be science presented and testimony and all of that. Are you yourself using laser in the practice now?
I am. Yeah. So,
Yeah.
for the Ohio Dental Association to say anything about anything, our house is our governing body. You can kind of think of it like Congress, is the way I explain it. And so we took a position. We'd love to see that. Obviously, everything in the state's governed by the state dental board, and so they're the ones that had their meetings, and they brought it up, and had the research and had hearings and comments, and then they develop the rules. It goes through a rulemaking process and then has to get approved. So they're in the middle of that rulemaking process right now, but it looks like we may have it. But yes, I've been using lasers for photobiomodulation for TMJ treatments, use it for tissue contouring. So mostly diode stuff. But
Mhm,
yes,
mhm.
absolutely. So we have the instrumentation should it
Yeah.
ever get approved already.
Okay, well, that's great. I love it. Like,
Yeah.
we're hearing more hygiene schools, more creative thinking around workforce impacts, and then expanding, at least putting those measures forward to help expand, the scope of practice there. I love that. What do
Yeah.
you think, um, what do you think are the next steps? I mean, I'm sure you've heard through your just, leadership in your practice and in, the state association. And I mean, goodness, if you ever have even once gone on social media and gone into a dental group, you've seen the madness that's out there. But what do you think are some of the first steps that we can do to really kind of rebuild this dentist hygienist relationship?
Yeah, so I had a few thoughts. I think the first step is really to rebuilding that trust is clarity. So clear expectations, clear roles and responsibilities, and really communication is the key to everything. So those open lines of communication, when communication shuts down, alternate narratives start happening on both sides, and
Yeah.
it's a mess. And then I think I try to provide structured opportunities for that shared dialogue. We just started again with a different cadence actually last week, but regular check-ins, calibration sessions if there's people having trouble, but just giving people the opportunity, whether it's in digital or in person, digital format through like one-on-one feedback or in person, to just give concerns and not feel like it's going to be the end of the world to do that. And I think it comes down to mutual respect on both sides. I feel like we just need to agree to be able to have courageous conversations. I'll steal that word from a wonderful mentor that I've had as well. But having those conversations, I think, is important. And then training, leveling up our care. I think if we all come together and learn new things, I think that is an experience that bonds us together and we learn together. I think we try to do a really good job. I actually use a digital platform to celebrate wins and have our whole team recognize one another. And I think that's part of our culture that is rewarding, because, in a practice, our practice is pretty big, as you know. It's hard for me to every day find every employee or every team member and say, hey, I noticed this. And so this shares that. But I think feeling valued, being heard, and really aligning around a common purpose are those things that are going to move us into the next stage of dental care in this country, in Ohio for sure.
Yeah. What is that platform that you use for that?
It's called Motivosity. It's used by a lot of, so you can think of it like it's basically like your office's own Facebook feed.
Okay.
And so what the requirements are is I provide, like, each team member gets a monthly budget. So let's call it $10. And so the goal is they go in and they say, let's say, I'll make up some names. Say Jane took my x-rays today. And so at the end of the day, they go in, hey, Jane, thanks for taking my x-rays today. That really helped me get through the day. You can put like a photo or a GIF or GIF, however you say that. And then you can attach a dollar amount and give them $1. And then they can cash those dollars or points in for gift cards. There's actually a debit card that they can have on their phone. They can go get coffee. And so it's actually like real money that our team shares around. And so not only do you get compliments, but you get a little cash along with it.
That's amazing. I've not heard of that. I love that idea. And then tell us about your book. You mentioned you wrote a book.
Yeah, it's called Lead from the Bottom.
Okay.
So it's around it's all centered around my take on how leadership should happen in a dental practice and how you build culture. It's really part of it's my story of how my practice came about and all of that. But yeah, it's really about how you get further together when you stand side by side, which is kind of why I call it a lead from the bottom, because I was tired of the top-down leadership structure. So, yep.
Okay, is it on Amazon? How can we?
It's on Amazon. Yep. Yeah, you can find it on Amazon.
Wonderful.
Yep.
All right, we'll put a link to that in the show notes, so hopefully everybody can grab your book. But thank you so much for being here with me. This has been a pleasure.
Yeah, it's been so much fun. I appreciate it.
Yeah, thanks for all you do and for working with Inspired Hygiene. We really enjoy and appreciate that, and to your team too. And I know everybody's really appreciate this episode. It's great insight that you have, Dr. Kyle, and thank you so much.
Thank you.
Thank you so much for listening to this episode of the Inspired Hygiene Podcast. We hope you got a ton of value and some things that you can really take away and implement now. So as always, we invite you, if we can help you in any way to optimize your hygiene department, head on over to inspiredhygiene.com. And as always, stay inspired.